All right, reason number two, why employers should care about Medicare. It's growing. This population, as we talked a little bit before about the macro trends, is growing, and it's growing very quickly. So these numbers that I'm about to give you come from the U.S. Department of Labor. And we look at 2022, about 7% on average of a given workforce in the United States had 7% of the people were over the age of 65. In 2025, the year we're in right now, it's crept up. It's now at roughly 0.5% higher. But let's look at 2030. It's about to jump big time. So almost 10% of the workforce is going to be over the age of 65. So now it's becoming more important for employers to think about this population that's still working, probably very valuable employees, but also very expensive employees as well from a healthcare standpoint. So what's driving this increase towards 10%? Well, there are a number of reasons, but one that may not be fully appreciated is something we call the Social Security gap. And I'm going to explain what that is by using this chart. So on the far left-hand side, you'll see years listed there, and that represents when a person turned 65. The second column is when they became eligible for Medicare. It's always been 65. You can see a consistent number there. But that's not true for Social Security. It used to be 65, but you can see that's changed. And then on the far right is the gap between Medicare and Social Security. Prior to 2008, if you walked off the shop floor or out of that office building for the last time because you had just turned 65, you left being assured that I've got my coverage for healthcare, Medicare, and I've got full employment, Social Security income. I'm in good shape. Well, Congress figured out that Social Security was losing money and couldn't keep up with this. So back in 2008, they said, you know what, we're going to push out that full retirement income on Social Security for a year. They did it all at once. So from 2008 to 2019, you had to wait a year. So now people are thinking, well, you know, maybe I should work a little bit longer because I want to get that full retirement income. Well, we got to 2019 and Congress said, we're still losing money out of Social Security. So we need to do something. But now we're going to push it out, but we're going to do it in a phased approach. We're going to do it over 6 years. So this year, 2025, is now a 2-year gap. So people are going to be working longer because, yeah, I got my Medicare coverage, but I'm not going to get my income that I was counting on because we got pushed out. There's no talk in Washington of changing the Medicare number, 65, but Social Security is still struggling. So I wouldn't be surprised if it's going to go beyond 2-year gap. It's going to be more than that in the future. So what does that mean for employers? Well, it's a threat. Because now you've got more high-cost people that are working longer in order to achieve that full retirement age, and that's going to have a negative impact on your budget, particularly as it grows to 10% of your population. But there's an opportunity, and the opportunity is if those employees decided, you know what, I think Medicare is actually better for me than the group health plan, then you may be able to keep these really valuable employees but lose the cost of having those employees when it comes to healthcare. They may just go to Medicare, and you've got the best of both worlds. Valuable employees, I don't have their healthcare costs.